Absolutely. It is an absolute pleasure to be able to introduce Dr. Jennie Ward Robinson as our keynote speaker this morning. I got introduced to Jennie by a mutual friend a few years ago, and we have become good friends ourselves because we have recognized that we have very similar values and passions. And as CEO of the Society to Improve Diagnosis in Medicine, Dr. Ward is passionate about improving health outcomes for all by achieving excellence in diagnosis. A transformational leader, Dr. Ward is known for engaging diverse interests and stakeholders to produce systemic solutions to human development challenges. Dr. Ward has more than 20 years of experience in leadership with academic, multilateral, nonprofit, for-profit organizations. Before she became the CEO of the Society to Improve Diagnosis in Medicine in 2021, she served as senior advisor to the dean of the College of Arts and Sciences at Georgia State University and as co-director of the Center for Studies on Africa and its Diaspora. Dr. Ward has successfully led initiatives all around the world in the US, Caribbean, Asia, Latin America, and she has received numerous awards for her work, including a Distinguished Alumni Award by the University of Houston for her work in minority health. Dr. Ward has served on various boards, including being the vice chair of the Caribbean Philanthropic Alliance. She holds a doctorate from the University of Wisconsin-Madison. Welcome, Dr. Ward.
Thank you and good morning. And Anne Marie, thank you for that wonderful. I was like, what's she talking about?
That's you. Absolutely.
And good morning. And I hope everyone can see my proud Barbadian flag in the background. While I'm wearing the gold of the colors, the blue, ironically, is represented in my corporate colors. So I am very excited to be here, and I thank you. And I want to send greetings to all the Caribbean leaders that will be on the stage with me that are part of your organization. I am honored that you chose me and invited me to speak about taking control of your health. I bring to the table not only the experience you talk about, but my own personal experience in taking control of my healthcare and that of my family. And for all of us listening today, we know that this is critically important. That taking control of your health is the key to actually experiencing a life course that is well lived, and failure to do that exposes us and predisposes us to risks that are untimely, unexpected, and oftentimes costly. At the Society to Improve Diagnosis in Medicine, our focus is on patients and working with patients, as you said, Anne Marie, to not only lift them up, lift up their knowledge, provide gateway opportunities, engage them in advocacy. All of it is focused on having patients become stronger in not only in their advocacy, but in their lives so that they can redistribute the power balance between the clinician and themselves as they seek care. So as I consider the work of DAHEI, I want to thank you. I want to thank Farah. And now I'd like to turn to my deck that I have to showcase what and support what I intend to deliver today, taking control of your health. Next slide. And so on this slide, what you will see is a, a list, as Anne Marie mentioned that I was a professor at one point. And so I like to tell you what I'm going to tell you. I like to say it, and then I like to repeat it. And I think that, as Anne-Marie mentioned, the notion of taking control of your health does not begin when you enter the doctor office. I think it is very important that we consider our health from the moment we experience a complaint or a concern, and then you think about the actions that are necessary in order to address that complaint and concern, all the way through to after the appointment and after the visit to the doctor. So today I'm going to frame that through the lens of addressing your complaint to receiving a diagnosis. I'm going to pause there for a moment and think about, what does it mean to have an accurate diagnosis? What are the types of diagnosis that can be received, and what happens if the diagnosis is incorrect? Then I'm going to talk about, how do you, as a patient, consider what is necessary to address your goals. Again, reaching back to when you visited the physician. What do you know about your healthcare record? And then how do you put all these pieces together in order to work on what becomes your care plan to address the complaint that you first presented to the physician with? Next slide. Let's go to the next slide after that. So in this slide, I purposefully created a photograph here because I want you to think about what it means. I don't know how many of us really sit and reflect on what it means when you present a complaint to the clinician, the nurse practitioner. When you enter the office, how many of you really think about a diagnosis, knowing that the diagnosis is the gateway from which a solution, a prescription, a care plan will be constructed? How many of us think about that? I had the opportunity of meeting with someone 2 days ago from the WHO's Safe Care Plan initiative, and we talked about patients and their reticence or lack of knowledge or question mark, whatever it might be, to think beyond arriving at the clinic, the hospital, the emergency room, presenting a complaint, and then sitting back, without recognizing that when you present, say, chapter 4 of an experience, that experience occurred long before you arrived at the doctor's office. And it also, that the experience that happened before is oftentimes oblivious to the clinician. But somehow I think we expect that we give sufficient information that the clinician might become a detective and therefore recognize and detect what is necessary in order to deliver treatment. And so I want to jerk you back to thinking about what happened when you had that first experience of discomfort that led to a complaint, that led to a concern, that brought you to the clinician. And I want to challenge you from today forward, understanding that it is that complete history. It is your family's history. It is your environment in which you live. All of that is relevant and necessary as you present your complaint in order to build a diagnosis. And these are the beginning steps of taking control of your health. Next slide. Next slide. Next slide. Good. And so here you are. You've arrived at the doctor's office. You've shared the information. Now, what are your expectations? I believe that you expect that you will receive a prescription. You will be advised to take a test. You will be given some sort of information that moves you across what I call the conveyor belt towards a healthcare plan. But wait, was the diagnosis correct? Was the diagnosis incorrect? Was there a delay in receiving that diagnosis? Or question mark? And all of this is important. And as a patient, you should be aware that all of these are possibilities that can happen. And in the process of the occurrence, you might lose control of your health if you're not aware that there are varying factors that can impact the diagnosis that you will receive. Now, everyone should expect an accurate diagnosis, but that accurate diagnosis depends on your being in control of your health, having your knowledge, having a good understanding of your health, your family's history, and therefore you communicate, and then the clinician is able to enter into a dialogue with you to construct and develop an accurate diagnosis. And by an accurate diagnosis, as I've written here, it says it should be timely, which means that it has the ability to interrupt the course of whatever that complaint was, and therefore set you on a path towards recovery or restoration as appropriate. But not only should that diagnosis be accurate, you'll note here that it has to be well communicated and received by the patient. And that is critically important because it's a two-way street. It is not simply that it is given to you, but you have a role to play in not only receiving it and understanding and knowing what has to be done next. But if, for whatever reason, it is missed, if the incorrect diagnosis is given, or if there's a delay because the appropriate test wasn't answered, you weren't given a physical exam, you weren't asked about the history, you weren't asked about the length of the occurrence, or a myriad of factors that can impact constructing an accurate diagnosis, what you will recognize then is that you are on the path to some sort of an error, and that in that error, now the course of the quality of your life may be disrupted, and disrupted in a way that may or may not be repairable. Next slide. This is a very sobering slide, and I want you to pay attention. And I believe that Farah and Anne Marie will make this deck available to you. And I encourage you to pay attention to everything that is documented, because what I've tried to do today is to break down what it means to take control of your health, but also to think about what happens when you fail to, or when you are unaware or uninformed or poorly informed about the role you play as a patient in your health care. Remember, in the slide before, I said an accurate diagnosis is one that is timely, well communicated, received by the patient, and a series of actions that follow are agreed upon and are able to be followed based on what is communicated. What happens when that fails? We have a diagnostic error. And a diagnostic error occurs then because an accurate and timely explanation of the patient's health problem was not clearly communicated, delivered, and understood by the patient. What role does the patient have in this risk? Did you ask to have your clinician reconcile the complaint that you arrived with the diagnosis and the treatment care that has been offered? If you did not, then here's a question that remains unresolved in terms of taking care of your health. Because in the communication portfolio of addressing that complaint that brought you to the clinician, it is incumbent on you to ask, and you have the right to ask for reconciliation. The clinician has said, here's the course of action we're going to undertake. Your question then should become, does this explain why I am feeling, experiencing, exhibiting the symptoms that brought me here today? This dance allows you to have an improved diagnosis and therefore an improved healthcare plan. Next step. Next slide. I'm showing this slide, and this has particular implications in the U.S. Because we've begun collecting this information, and in fact, diagnostic error has been known and has been recorded since the early 50s, but it really came to full head, full steam, full awareness in the public domain, in the hospital association, medical association, healthcare system, at the level of our political leaders, when we began to realize through statistics that 1 in 3 patients may in fact experience diagnostic error firsthand. That's sobering. Or that the median age of a patient with a faulty diagnosis is 49, and most of those are females. That is particularly disturbing, given that women are typically the gatekeepers of health in the family. So now not only must you be aware of taking control of your health, but of your family's health. What happens if that misdiagnosis leads to a permanent disability? Or what happened if the incorrect test that resulted in a miss or delayed diagnosis has now presented an undue burden of financial costs on you as a consequence of the delay or the inaccuracy of the diagnosis? And if I were sitting in the audience, my question to this slide would be, what does this mean for people of color that are typically represented by those of us from the Caribbean countries? And you will note that there's nothing here, because that data remains uncollected, which in and of itself then presents a difficult kind of challenge in really addressing and mitigating the idea of an incorrect, miss, or a delayed diagnosis for people of color. This again really underscores why it is important to take control of your health. Next slide. And the next slide really shows the dimensions of error and harm and the cost, not only to society, but to individuals. So when Anne-Marie said it is important that we take control of our health, it might sound very simple and casual, but what she is awakening in us is a gateway to education of what happens when we do not take control of our health. And this slide articulates the tip of the iceberg. In other words, we may end up with a diagnosis that is not correct, a disease might be misclassified, or the progression of a developing concern might take root because it goes untreated. Next slide. Interestingly, patients do recognize when something happens incorrectly. They do. And this was documented in the publication that is shown on the footnote of this slide. And you will see the degrees to which patients recognize that things do go wrong. But what do we do about that? Next slide. This slide speaks to an organization that monitors patients' concerns and monitors diagnostic errors that occur within care delivery system annually. And they collect the information from patients. So patients recognize, patients speak about it, patients know about it. Taking control of your health gives you an opportunity to speak and require accountability, expect good care delivery, work in partnership with your clinical community so that you avoid not only the pain, the burden, the cost, and the mental anguish that comes when an error occurs. Next slide. And this slide really talks about the degree of harm that occurs across healthcare at large. And you will see that this is a public health imperative, which means it should concern all of you, all of us that seek care, because we are all patients. We're all patients. Those of us that are female care for our families. No offense to males, because I know that males do as well. But this slide is intended to show you what we know, but it is also intended to show you what we do not know. And again, this is why taking control of your health, becoming informed, becoming advised, becoming empowered to ask questions and require solutions become critical to avoiding healthcare and diagnostic errors. Next slide. So I would be remiss if I did not begin to talk about what can be done or what is being done. The organization I lead is a nonprofit organization that is actively involved with patients to capture the information I showed in the preceding slides, to engage the clinicians that are seeking solutions, to fund research to find better ways of engaging patients, better ways of understanding the 0 through 4 of a complaint a patient might have and how that gets communicated to the clinician. We are actively engaged in placing patients within grand rounds, teaching clinicians so that they can understand the experiences that may have led to the complaint before you came to the complaint. We're also actively engaged with patients to figure out what change management strategy might be appropriate in the hospital in order to reduce the risk of harm. And then we're also actively engaged with patients who've taken control of their health to go to the Hill and have Patient Safety Week in March, Patient Safety Awareness globally, which considers the Caribbean and Latin America as well, on the Hill in September. Next slide. Next slide. So I've talked about your complaint. I've talked about what happens when the complaint may not be clearly documented, may not be clearly understood, may not be well communicated, where something might have been missed. I've talked about what is being done at a global, at a national level. But now let's talk about what can you do as a patient, as a person listening to my voice today. What can I do to take control of my health specifically? This slide gives you very concrete steps regarding what you must do to take control of your health. First, know your medical history. For those of us that are removed from our country of origin or our family's country of origin, that means we have a little bit of extra work to do because we need to be clear and know our family's medical history, because it will not be in our health record here. And it becomes important then that we not only maintain those connections, but excavate that knowledge from home so that we know our medical history. Anne Marie talked about her mom and her experience as a child, dreaming of addressing healthcare based on what she experienced with her mom. I share that same experience. That drove me to the role that I am in. It drove me to the work that I've done across my life. I encourage you to know your medical history. It did not begin with you. It began with your family. That means work. Second, before you go to the clinician, when you have a complaint, actively construct your conversation in your head and know what your goals are. What do you want to get out of this? Do you simply want a prescription? Do you simply want an answer so the problem is solved? Or are you willing to understand uniquely what it is, knowing that you now are laying out the history for those that will follow you in your family tree? Did you receive a physical exam? If not, ask for it. Sometimes touch reveals more than conversation. And here again, as you take control of your health, please follow up on the actions that are given. If you do not understand them, discuss them, ask questions. Your health record, you're entitled to see by law. You do not understand? Engage the nurse, the clinician. Write a letter, ask a question. Have that letter ready before you go on your next visit so that you can understand what it means. What does this data mean with respect to the test that you were given or the test you participated in or the prescription that was prescribed to you? And finally, agree on an explanation for the symptoms. Make sure it makes sense. Make sure that what is given to you aligns with, in some ways, with what you're experiencing. And finally, ask for a referral if necessary. Next slide. This is a critical component and one of the final components in taking control of your health. Revisit the doctor as necessary to make sure things make sense and engage your family. Their community health providers, ask them to make sense. Engage with them to make sense. Taken together, next slide, you will begin to take action. And in taking action, become educated, become aware. I've given a couple of sites that you might visit to gain more information so that you can begin to not only build your knowledge, but in taking action, you will take control of your health. Thank you. It's been a privilege, and I am absolutely thrilled to answer or attempt to answer questions that will be given today. Thank you again for this opportunity.
Oh, wow. Thank you, Dr. Ward. This was an amazing keynote address on how we can take control of our health. And really, when it comes to being an advocate for ourselves, and even if someone is like Risha Felix is just saying, I love this. Sometimes we're afraid of asking questions because we're either afraid of the possible news or we're just okay with whatever the doctor or nurse says because they're authority figure. And that's very true. Sometimes we feel afraid to ask, but we feel afraid to step up for ourselves. And Dr. Ward is telling you today, you are your advocate. Make sure when you go to the doctor, you have everything laid out. So if they ask you any questions, you can answer the questions. If they ask you questions about medication, you know exactly how much you're taking, you know the scientific name, you know everything, you know the amount that you're taking, because they need to know that so that they can treat you. So take control of your health and be an advocate for yourself. So do we have any questions? The floor is anyone who has any questions, please share your questions in the chat And that way we can ask Dr. Ward. Oh, everyone is loving this. Thank you, Dr. Ward. This was amazing. Oh, beautiful. Dr. Obashan, thanks, Dr. Ward. So do we have any questions? Has anyone had an experience they may want to share, and how were they an advocate for themselves, or maybe they were afraid of asking a question, but this really helped them? Just share with us and let us know, because Dr. Ward would be very happy to share from her extensive expertise and experience. This was an amazing, Dr. Bourbon just said this was an amazing presentation. Thank you, Dr. Ward. Oh, here we go. Here we go. Okay, so good information, and you must advocate for yourself. Beautiful. Annette Phillip says, yes, that's very important to know. So do we have any questions? Does anyone have any questions they would like to ask Dr. Ward? Oh.
I'd like to make a comment on the person that it was the first person who spoke about the personal inhibition to speak to the clinician because they're an authority figure.
Richard Felix, I just put them back on, yes.
Yes. And I want to say that's quite normal. It's quite normal. But let me challenge you to think of it this way. When your car requires repair, you do not know as much as the mechanic does about your car. But you do not give the mechanic your checkbook and the car and walk away with what the mechanic says should be done. You do not. With anyone that comes to your house to repair something, they have to diagnose based on what you said the symptoms are. And unless you're satisfied, you do not give over your checkbook, and you do not allow them to walk away as if it's resolved because of fear and anxiety and the idea that you don't want to know. You do want to know. Yeah. You do want a solution. And it is not about authority. What it is, this person is an asset. This is a partner in your care. Begin to see them in this way as you take control of your health, and ask the question if you do not understand. If they've used a word that you do not understand, ask. I have patients who say to me, and I'm not advocating that anyone should take this path, but I'm saying patients literally will write it down to make sure they have correct spelling, go home, go to the library or go wherever, get information. And then today, because we have telehealth opportunities, send the clinician an email and ask a question to further clarify. So there are lots of ways in which you can, and you do not necessarily have to violate the respect parameter of that authority figure because they're part of your care plan, but see them as a partner in your care plan. And as a partner, you both need to be clear on what the next steps are. And then you can embark on doing your part in order to arrive at a safe outcome and to really take control of your health. The final thing I will say, it is imperative because more than likely you have someone downstream from you that will need this information for their life in the future. And so it does not end with you and your experience. It is critical then that I make sense of my health because my son needs to know what my health conditions were for his quality of life. So it has far-reaching implications than just the experience of power distributed in that moment of contact with the clinician.
Beautiful. Thank you. That's very important that you just shared that, because sometimes just forgetting that orally we pass on stories.
That's right.
And because we've migrated away from home,
yes,
our auntie or great aunt or great grandmother, because we're not connected as to the land as we were before we moved away, we wouldn't know. And so it's very important as you navigate life, not just think of yourself, but think of your children and their children. As you experience things, you tell them, you write it down, even making something like a digital, like family health log. That way that if something were to happen to you, That way your family knows their previous history, and that
Yes,
way they can navigate their role moving forward. Beautifully said, Dr. Ward.
absolutely.
We have another question. We have a question from Joe Harry. Here we go. So Joe says, how do you navigate when patients doubt your recommendations?
That is an excellent question. Remember in one of the slides, I said, make sure that the solution maps to your complaint. And it may require a second opinion. It may require a second visit. It may require your documenting the experience, and in that second visit, going over that second visit. What is important in this question is the idea that what you've heard does not ring through with what you're experiencing. And so you have every right to ensure that they align, because when they do not align, if you're given a prescription or you're recommended for a procedure, and we've all heard of these experiences where someone was diagnosed with something only to find out they were not, that it was not accurate. So it becomes important that the two map together. And when they don't, in your mind, revisit, require, or a second opinion. This is a great question as well. The three barriers. The three barriers begin with one that the previous person noted as the perception of authority. So what I call that power distribution, power imbalance. The second is feeling not worthy, equipped, and capable to engage with this person in authority. And the third I would advance is a lack of information about your health, your experiences, your history, and therefore this limits your ability to really and clearly articulate in order to deliver the information to the clinician. Today, clinicians have an average of somewhere between perhaps 8 and 15 minutes to spend with a patient. So it becomes absolutely important knowing that when you go, you're clear about what your goals are, you're clear about why you're there, you're armed with information if this is a novel visit or if it is an experience from the past, that you have that history. And then you go, I go to the clinician with a notebook because I want to follow up. And again, as I said, I'm doing this because I want to make sure that if something happens and I cannot speak, my husband knows, my son knows. So the one thing I would challenge you to do is first become aware, become knowledgeable, know that you know what's wrong with you. You know that better than the clinician. They can make a decision as best as you can share with them. And the more you can share, the more accurate, the more tight, then it becomes possible to arrive at the outcome that you seek, and the barrier is removed.
Beautiful. Thank you very much. Thank you very much, Dr. Wood. I believe, do we have any more questions? I believe so. Patty Better just said that I've had physicians become indignant when I try to understand the recommendations with my mom. If a doctor will not engage in dialogue, I look for a new physician. Well said, Patty.
Well said. Absolutely. Yeah. Kudos. Yeah. I've done it. And I will say, I don't know Patty's country of origin, but in Barbados, and I think typically in the Caribbean, and I know in African American communities, Black families in the US and outside, we have a caregiver community that responds to issues when we have a problem. And so The model here is the clinician and the patient. Well, we don't operate that way. So we ask for the respect of caregiving, particularly when you have parents that are older, parents that may not be able to articulate as well, but we know the history. And you're absolutely correct. We changed physician. So I applaud you for doing that, because that is very much the appropriate step. The clinician must be your partner. If they're not, with respect and a willingness to listen, with humility, change the physician.
Well said, Dr. Wood. I think that was the closing. If the physician is not respectful, you change the physician. Dr. Ward, this has been an amazing keynote address. It has been a pleasure meeting you personally as, a fellow West Indian, meeting you who've been in the industry for so many years. I look up to you. Thank you for all you've done for all of us, whether we're from the Caribbean or not, but just in understanding how we can be advocates for ourselves and our families. So I just want everyone to do a round of applause in the chat. Round of applause in the chat for Dr. Ward. Thank you again. And if you have any questions for Dr. Ward, you can always send them to us at DAHEI. We can reach out to Dr. Ward for you. And we'll also be putting Dr. Ward's presentation on DAHEI's website. So there'll be resources that Dr. Ward created just for us. Thank you again. That way you can always access it when you need this information. Again, Dr. Ward, thank you, and enjoy the rest of the event.